Hello, everyone. Welcome to another Q&A assessment for our LAMP students. We continue with the musculoskeletal system. Let's welcome Mama Athena from California. Good evening, Mama Athena. Good morning.
Hello, good morning.
Okay, let's continue. Let's discuss the muscle. Let's do a Q&A for the muscles of the whole body front view. Which muscle is number 10?
The brachioradialis,
Vastus medialis is what number?
number 14,
Sternocleidomastoid.
number 4,
Tibialis anterior.
number 15,
Trapezius.
number 5,
Number 6.
the deltoid,
Number 3.
the orbicularis oris,
Number 9.
the external oblique,
Vastus lateralis.
number 13,
Number 12.
the
Solid.
iliopsoas,
Number 8.
that's the biceps brachii,
Rectus abdominis.
that's number 11,
Pectoralis major.
number 7,
Number 1.
frontalis,
Number 2.
that's the orbicularis oculi,
Number 2.
that's the masseter,
Number 10.
the adductor longus,
Vastus intermedius. What number?
number 12.
Number 8.
Number 8 is the flexor carpi ulnaris.
Temporalis. Number.
Number 1.
Tensor fasciae latae.
Number 6.
Transversus abdominis.
Number 5.
Number 13.
The gastrocnemius.
Serratus anterior.
Number 4.
Soleus.
Number 15.
Zygomaticus.
That's number 7.
Number 11.
Sartorius.
Number 3.
Galenis.
The scalens. Number
Scalene.
9.
The pectineus.
Number 14.
That's the peroneus longus.
Number 6.
Number 6 is the biceps femoris.
Semitendinosus.
Number 4.
Number 7.
The gastrocnemius.
Triceps brachii.
It's number 2.
Soleus.
That's number 8.
Semimembranosus.
That's number 5.
Number 10.
The deltoid.
Number 15.
The gracilis.
Trapezius.
Number 9.
Number 14.
That's the gluteus medius.
Number 11.
That's the infraspinatus.
Number 3.
The gluteus maximus.
Number 13.
The flexor carpi ulnaris.
Occipitalis.
That's number 1.
Latissimus dorsi.
Number 12.
Now we go to muscles of the whole body, side view. Number 10.
That is the frontalis.
Temporalis. What number?
Number 1.
Sternocleidomastoid.
Number 2.
Number 3.
That's the deltoid.
Number 12.
That's the biceps brachii.
Number 13.
The rectus abdominus.
Gluteus maximus.
That's number 7.
Gastrocnemius.
It's number 15.
Number 11.
11 is the pectoralis major.
Number 9.
That's the tibialis anterior.
Latissimus dorsi.
It's number 4.
Sartorius.
It's number 14.
Number 8.
Number 8 is the vastus lateralis.
Number 5.
Number 5 is brachioradialis.
Extensor digitorum.
Number 6.
Occiput.
Number 1.
Number 10.
The orbicularis oris.
Number 14.
That's the vastus medialis.
Number 12.
That's the external oblique.
Number 2.
That's the trapezius.
Serratus anterior.
That's number 4.
Number 6.
The gluteus medius.
Iliotibial tract.
That's number 7.
Adductor longus.
Number 13.
Triceps brachii.
The number 3.
Number 9.
That's the orbicularis oculi.
Biceps femoris.
That's number 15.
Number 8.
That's the soleus.
Extensor carpi ulnaris.
The number 5.
Number 11.
That is palmaris longus.
Now we'll go to muscles of the face, head and neck. Let's start with the face. Number 9.
That is the frontalis.
Number 15.
That is the orbicularis oris.
Buccinator.
That's number 6.
Zygomaticus major.
That's number 13.
Procerus.
That's number 10.
Number 2.
The temporalis.
Number 11.
The orbicularis oculi.
Number 11. Number 1.
The galea aponeurotica.
Mentalis.
That's number 7.
Corrugator supercilii.
That is number 3.
Risorius.
That's number 14.
Number 8.
The sternocleidomastoid.
Masseter.
Number 5.
Nasalis.
Number 4.
Zygomaticus minor.
That's 12.
Number 1.
That is the orbicularis oculi.
Palpebral part. Number 11.
Yes. That is the dilator naris.
Zygomaticus minor.
It's number 10.
Muscle number 4.
That's the levator anguli oris.
Temporoparietalis.
That is number 8.
Number 9.
The orbicularis oculi, the orbital part.
Number 5.
That is the depressor septi nasi.
Number 2.
That's the levator labii superioris aliquae nasi.
Sternohyomastoid.
Number 7.
Depressor labii inferioris.
That's number 6.
Muscle number 15.
That is the omohyoid.
Platysma insertion only.
That is number 13.
Number 3.
That is the levator labii superioris.
Muscle number 14.
That's the depressor anguli oris.
Risorius.
That's number 12.
Now let's go to the head muscle locations. Number 1.
Number 1 is the epicranial aponeurosis.
Trapezius.
Number 7.
Number 11.
The orbicularis oris.
Number 8.
The frontalis.
Orbicularis oculi.
Number 9.
Number 9.
It's the orbicularis oculi.
Temporalis.
That's number 2.
Number 6.
The levator scapulae.
Orbicularis oris.
Number 11.
Sternocleidomastoid.
Number 4.
Platysma.
Number 13.
Number 3.
That is the occipitalis.
Number 10.
That's the masseter.
The splenius capitis.
Number 5.
Number 12.
The mentalis.
Orbicularis oris.
That is number 11.
Number 7.
It's trapezius.
Number 9.
The orbicularis oculi.
Orbicularis oculi is
Number 9.
number 2.
That's the temporalis.
Frontalis.
That's number 8.
Number 11.
The orbicularis oris.
Occipitalis.
That's number 3.
Epicranial aponeurosis.
Number 1.
Number 13.
It's the platysma.
Levator scapulae.
That's number 6.
Mentalis.
That's number 12.
Number 5.
It's the splenius capitis.
The masseter.
It's number 10.
Number 4.
It's the sternocleidomastoid.
Orbicularis oris.
It's 11.
Number 13.
Platysma.
Mentalis.
That is number 12.
Number 4.
That's the sternocleidomastoid.
Levator scapulae.
Number 6.
Number 7.
Trapezius.
Epicranial aponeurosis.
That's number 1.
Number 8.
That is the frontalis.
Temporalis.
That's number 2.
Number 10.
That's the masseter.
Splenius capitis.
It's number 5.
Number 3.
That's the occipitalis.
Number 9.
The orbicularis oculi.
Orbicularis oculi is
Number 9.
number 11.
That's the orbicularis oris.
Now we go to the head muscle actions. The action of the frontalis is to
Adjust the position of the ear, extend and rotate the atlanto-occipital joint, and pull the scalp forwards.
no, you have to choose only one.
Reading
Frontalis.
so the answer is pull the scalp forward.
Pull the skull forwards, the frontalis. Action of the temporalis.
It's the elevate and retract the mandible.
Action of the levator scapulae.
It's to elevate the scapula and help to retract it.
Action of the trapezius.
It's to pull up the shoulder girdle, adduct, depress, and rotate the scapula.
Action of the masseter.
Close the jaw and clench the teeth.
Which of the following will pull the skull backwards?
It's the occipitalis.
Action of the sternocleidomastoid.
It flex and laterally rotate the cervical spine.
Action of the mentalis.
It elevate and protrude the lower lip.
Action of the occipitalis.
It pull the scalp backwards.
Position of the ear is adjusted by
It's the auricularis.
action of the orbicularis oculi is to
Close the eyelid.
the blank pulls the scalp forwards.
The frontalis.
Action of the splenius capitis is to
Extend laterally, rotate, and flex the head.
action of the orbicularis oris.
Is to close and purse the lips.
Action of the platysma.
The platysma draw the lower lip inferiorly and posteriorly.
Muscle that purses the lips.
That's the orbicularis oris.
Action of the rectus capitis anterior.
That flex the atlanto-occipital joint.
Action of the zygomaticus major is to.
Elevate and draw the angle of the mouth laterally.
The blank closes the eyes.
That's the orbicularis oculi.
The action of the rectus capitis posterior is to.
It extend and rotate the atlanto-occipital joint.
An important muscle for whistling.
The buccinator.
The action of the scalenus anterior is to.
Rotate the neck and elevate the first rib.
Action of the zygomaticus minor.
Elevate and invert the upper lip.
Corner of the mouth is retracted by.
The risorius.
Action of the orbicularis is to.
Adjust the position of the ear.
Action of the scalenus posterior is to.
Elevate the second rib and tilt the neck.
Action of the risorius.
To retract the angle of the mouth.
Action of the buccinator.
It compresses cheeks against the teeth.
Action of the corrugator supercilii.
It wrinkles the forehead.
Action of the orbicularis oculi.
It closes the eyelids.
Action of the lateral pterygoid.
It depresses and protrudes the mandible.
Action of the zygomaticus minor.
It elevate and invert the upper lip.
Action of the superior rectus.
It elevates and medially rotate the eye.
Action of the splenius cervicis.
It extends and rotates the cervical spine.
Action of the obliquus capitis inferior.
It rotates the atlantoaxial joint.
Action of obliquus capitis superior.
It extends and flexes the head.
Action of zygomaticus major.
It elevate and draw the angle of the mouth laterally.
Action of the superior oblique.
Internal rotation and lateral rotation of the eye.
Action of the scalenus minimus.
It's to elevation of the first and second ribs.
Action of the rectus capitis anterior.
Flux the atlanto-occipital joint.
Action of rectus capitis lateralis.
Laterally flex the atlanto-occipital joint.
Action of the scalenus posterior.
It elevates the second rib and tilt the neck.
Action of the rectus capitis posterior.
It extend and rotate the atlanto-occipital joint.
Action of the scalenus anterior.
It's to rotates the neck and elevates the first rib.
Action of the scalenus medius.
It elevates the first rib and rotate the neck.
Now we go to origins and insertions for the muscles of face, head, and neck. Origin of the frontalis is.
The epicranial aponeurosis.
Or insertion of the masseter is.
The angle and ramus of the mandible.
Insertion of frontalis.
Is the skin superior to the supraorbital margin.
Origin of the mentalis.
It's the anterior mandible.
Origin of the occipitalis.
It's the occipital bone and the mastoid process of the temporal bone.
Insertion of the mentalis.
It's the skin of the chin.
Insertion of the occipitalis is.
The epicranial aponeurosis.
Origin of the sternocleidomastoid is.
It's the sternum and the clavicle.
Origin of the trapezius is.
The spinous processes of vertebrae T7 to T12 and the ligamentum nuchae.
Nuchae.
Okay.
Insertion of the temporalis.
Is the coronoid process and ramus of the mandible.
Insertion of the trapezius.
It's the clavicle, acromion, and spine of scapula.
Origin of the orbicularis oris.
It's the muscle fibers surrounding the opening of the mouth.
Origin of the masseter.
It's the zygomatic arc and maxilla.
Origin of temporalis.
It's the temporal bone.
Insertion of the sternocleidomastoid.
It's the mastoid process of the temporal bone.
Origin of the levator scapulae.
The transverse processes of the superior 4 to 5 cervical vertebrae.
Insertion of the platysma is at the
base of the mandible, the skin of the cheek and lower lip, and the orbicularis oris.
origin of the orbicularis oculi is
The medial wall of the orbit.
insertion of the levator scapulae is
The superior vertebral border of the scapula.
insertion of the orbicularis oculi is
The circular path around the orbit.
origin of the sternocleidomastoid is
It's the sternum and the clavicle.
insertion of orbicularis oris.
It's the skin at the corners of the mouth.
Insertion of the sternocleidomastoid.
It's the mastoid process of the temporal bone.
Origin of the scalenes.
It's the cervical vertebrae, the second C2 and
C2 to
CV2,
C7.
C7. Oh, sorry.
The origin
C7.
of the splenius capitis is
The nuchal ligament and spinous process of C7 to T3.
insertion of the scalenes is
The first and second ribs.
insertion of the splenius capitis is
The occipital bone and the mastoid process of the temporal bone.
origin of the buccinator is
The alveolar processes of the maxilla and mandible and the
pterygomandibular
pterygomandibular
arcade.
artery.
Origin of the platysma.
It's the subcutaneous tissue of the infraclavicular and supraclavicular regions.
Or insertion of the buccinator is
The fibers of the orbicularis oris.
origin of the splenius capitis.
The nuchal ligament and spinous process of C7 to T3.
Insertion of the scalenes.
It's the first and second ribs.
Insertion of zygomaticus minor.
The skin of the upper lip.
Insertion of the splenius capitis.
The occipital bone and the mastoid process of the temporal bone.
Insertion of zygomaticus major.
It's the skin at the angle of the mouth and the orbicularis oris.
Origin of the corrugator supercilii.
The medial end of the superciliary arch of the frontal bone.
Origin of the levator scapulae.
The transverse processes of the superior 4 to 5 cervical vertebrae.
Insertion of the levator scapulae.
The superior vertebral border of the scapula.
Insertion of the corrugator supercilii.
The forehead skin near the eyebrow.
Origin of the risorius.
The fascia over the parotid gland.
Origin of the zygomaticus major.
The zygomatic bone.
Insertion of risorius.
Skin at the angle of the mouth.
Origin of zygomaticus minor.
The zygomatic bone.
Origin of the scalenes.
The cervical vertebrae from C2 to C7.
Insertion of the scalenes.
It's the first and second ribs.
Now let's go to muscles of torso. Locations, anterior. Platysma is indicated by number
1.
Number 2 is
The trapezius.
number 1.
Number 1 is the platysma.
Internal oblique.
That's number 16.
Rectus abdominis.
That's number 14.
Transversus abdominus.
Number 15.
Number 3.
It's the deltoid.
Inguinal ligament.
Number 8.
Number 11.
That's the sternocleidomastoid.
Number 8.
The inguinal ligament.
External oblique.
That's number 7.
Serratus anterior.
Number 6.
Trapezius.
That's number 2.
Number 15.
That's the transversus abdominis.
Pectoralis major.
That's number 4.
Number 13.
That's biceps brachii.
Number 14.
The rectus abdominis.
Latissimus dorsi.
That's number 5.
Number 16.
That's internal oblique.
Deltoid.
That's number 3.
Number 4.
The pectoralis major.
Sternocleidomastoid is number
11.
Number 5.
That's the latissimus dorsi.
Number 12.
It's the scalenes.
Scalenes are number
12.
biceps brachii.
That's number 13.
Number 7.
The external oblique.
Number 2.
The trapezius.
Transversus abdominus.
That's number 15.
Number 11.
The sternocleidomastoid.
Then we go to the muscles of the torso, locations posterior. Number 30.
The teres major and minor.
Latissimus dorsi, or dorsi, sorry.
That's number 22.
Number 28.
That's the rhomboid major and minor.
Iliac crest.
That's number 24.
Number 29.
That's the infraspinatus.
Number 31.
The serratus posterior.
Deltoid.
That's number 20.
Number 33.
The thoracolumbar fascia.
Trapezius.
Number 19.
Infraspinatus.
That's number 29.
Number 19.
The trapezius.
Serratus posterior.
That's number 31.
Thoracolumbar fascia.
Number 33.
Number 20.
That's the deltoid.
Number 23.
The external oblique.
Number 22.
That's the latissimus dorsi.
Teres major and minor.
That's number 30.
Rhomboid major and minor.
That's number 28.
Number 24.
That's the iliac crest.
Number 27.
The supraspinatus.
Number 26.
The levator scapulae.
Supraspinatus.
That's 27.
Levator scapulae.
That's 26.
Serratus posterior.
That's 31.
Number 31.
That's serratus posterior.
Number 20.
That is the deltoid.
Trapezius.
That's 19.
Number 33.
That is the thoracolumbar fascia.
Number 23.
That's the external oblique.
Deltoid.
That is number 20.
Now let's go to actions of the muscles of the torso. Action of external oblique is to retract and stabilize the scapula. True or false?
That is false.
Which of these muscles flex the elbow joint?
The biceps brachii.
Action of the biceps brachii is to
Flex the elbow joint and supinate the forearm.
Action of the diaphragm is to cause inhalation and exhalation. True or false?
Is true.
Which of these muscles flex the humerus?
The anterior part of the deltoid.
The action of the anterior part of the deltoid is
To flex and medially rotate the humerus.
action of the posterior part of the deltoid is to flex the elbow joint. True or false?
Is false.
Yeah, because the posterior deltoid, located at the back of the shoulder, also rotates the joint laterally to move the arm outward and backward. During extension, the posterior deltoid allows the humeral head to rotate downward and inward in the socket of the joint. Which of these muscles abduct the humerus?
It's the middle part of the deltoid.
Action of the middle part of the deltoid is
To abduct the humerus.
action of the middle part of the deltoid is to abduct the humerus. True or false?
It's true.
Which of these muscles extend the humerus?
It's the posterior part of the deltoid.
Action of the posterior part of the deltoid is to
Extend and laterally rotate the humerus.
one of the actions of the anterior part of the deltoid is to extend the humerus. True or false?
That is false.
Because the front deltoids that help move your arm forward, no? They connect to your clavicle. You use your front deltoids if you reach for an object on a shelf. Which of these
Yes.
muscles cause inhalation and exhalation?
It is the diaphragm, of course.
One of the actions of the biceps brachii is to flex the elbow joint. True or false?
It is true.
The action of the platysma is to compress the abdomen.
That is false.
When the entire platysma is in action, it produces a slight wrinkling of the surface of the skin of the neck in an oblique direction at an angle to the midline. Which of these muscles flex the vertebrae?
It's the external oblique.
The action of the diaphragm is to
Cause inhalation and exhalation.
the action of the pectoralis major is to adduct and medially rotate the humerus. True or false?
That's true.
Which of these muscles laterally rotate the humerus?
It's the infraspinatus.
Actions of the external oblique are to
Compress the abdomen and flex or rotate the spine.
the action of the levator scapulae is to flex the thoracic vertebral column. True or false?
That is false.
As its name suggests, the main function of this muscle is to elevate the scapula. Additionally, levator scapulae acts with the trapezius, latissimus dorsi, rhomboids, pectoralis major, and pectoralis minor muscles to inferiorly rotate the glenoid cavity, stabilize the spine, and extend and laterally flex the neck. Which of these muscles compress the abdomen?
The internal oblique.
Action of the infraspinatus is to
Laterally rotate the humerus.
actions of the latissimus dorsi are to adduct and medially rotate the humerus.
That is true.
Which of these muscles adduct and medially rotate the humerus?
The latissimus dorsi.
The actions of the internal oblique are to
To compress the abdomen and flex or rotate the spine.
actions of the internal oblique is to cause inhalation and exhalation. True or false?
That is false.
Which of these muscles elevate and help to retract the scapula?
The levator scapulae.
Action of the infraspinatus is to laterally rotate the humerus. True or false?
That is true.
Action of the latissimus dorsi is to
To laterally rotate the humerus.
which of these muscles extend the flex arm? Which of these muscles adduct and medially rotate the humerus?
It's the pectoralis major.
Action of the sternocleidomastoid is to laterally rotate the humerus. True or false?
That is false.
Rotation of the head to the opposite side or obliquely rotate the head. It also flexes the neck. Action of the levator scapulae.
It's to elevate and help to retract the scapula.
Which of these muscles draw the outer part of lower lip inferiorly and posteriorly?
That's the platysma.
The action of the serratus posterior is to depress the lower ribs, aiding in expiration. True or false?
That's true.
Action of the pectoralis major is
To adduct and medially rotate the humerus.
which of these muscles flex the vertebral column?
The rectus abdominis.
Action of the anterior serratus anterior is to raise the sternum in deep inhalation.
That is false.
Yeah, it draws the scapula anterolaterally, no? Suspends the scapula on the thoracic wall. Action of the platysma.
Is to draw the lower lip inferiorly and posteriorly.
Which of these muscles retract and stabilizes the scapula?
The rhomboid major and minor.
When they work together, the scalenes flex the neck and raise the rib in strong inhalation. True or false?
True.
The action of the rectus abdominis is
It's to flex the vertebral column and compress the abdomen.
one of the actions of the rectus abdominis is to flex the vertebral column. True or false?
True.
The action of the rhomboid major and minor is to depress the lower ribs, aiding in expiration. True or false?
That is false.
So the scapulothoracic joint draws scapula superomedially, rotates the glenoid cavity inferiorly, supports the position of the scapula. Action of the rhomboid major and minor is
Retract and stabilize the scapula.
which of these muscles flex and rotate the neck?
That's the scalenes.
Action of the supraspinatus is to initiate abduction at the shoulder joint. True or false?
That's true.
What's the action of the scalenes?
It is to raise the first rib and flex or rotate the neck.
Which of these muscles protract and rotate the scapula?
The serratus anterior.
The action of the teres major is to flex or rotate the vertebral column. True or false?
False.
Yeah, the answer should be extension and internal rotation of the humerus. Action of the serratus anterior is to
Retract and rotate the scapula.
which of these muscles depress the lower ribs, aiding in expiration?
The serratus posterior.
The action of the teres minor is to laterally rotate the humerus. True or false?
That is true.
The action of the serratus posterior is to
Depress the lower ribs, aiding in expiration.
which of these muscles flex the neck and tilt the head?
It's the sternocleidomastoid.
The action of the transversus abdominis is to flex the vertebral column. True or false?
False.
So bilateral contraction, it compresses the abdominal viscera, expiration. It causes trunk rotation, ipsilateral. Actions of the sternocleidomastoid are to
Flex the neck and raise the sternum.
which of these muscles initiate abduction at the shoulder joint?
The supraspinatus.
The action of the upper part of the trapezius is to pull up the shoulder girdle. True or false?
True.
The action of the supraspinatus is to
Initiate abduction at the shoulder joint.
which of these muscles extend the humerus?
It's the posterior part of the deltoid.
Which of these muscles adduct, medially rotate, and extend the humerus?
It is the teres major.
The action of the teres major is to
It's to adduct, medially rotate, and extend the humerus.
the rotator cuff muscle includes the trapezius, pectoralis major, and the latissimus dorsi. True or false?
That is true.
Yeah. Which of these muscles laterally rotate the humerus?
It's the teres minor.
The action of the teres minor is to.
It's to laterally rotate the humerus, not the
Action of the
uterus.
subscapularis is to stabilize shoulder joint and medially rotate the humerus. True or false?
True.
Which of these muscles compress the abdomen?
The transversus abdominis.
The action of the transversus abdominis is to.
It compresses the abdomen.
The action of the lower part of the trapezius is to depress the scapula. True or false?
That is true.
Which of these muscles pull up the shoulder girdle?
It's the upper part of the trapezius.
The action of the upper part of the trapezius is to.
Pull up the shoulder girdle.
The action of the middle part of the trapezius is to flex the vertebral column. True or false?
False.
Which of these muscles cause inhalation and exhalation?
It's the diaphragm.
Which of these muscles laterally rotate the humerus?
It's the infraspinatus.
The action of the middle part of the trapezius is to.
Retract or adduct the scapula.
Which of these muscles flex the vertebrae?
The external oblique.
The action of the lower part of the trapezius is to.
Press the scapula.
Which of these muscles stabilize shoulder joint?
The subscapularis.
The action of the upper and lower parts of the trapezius together is to.
It's to rotate the scapula.
Which of these muscles rotate the scapula?
It's the upper and lower parts of the trapezius.
The action of the subscapularis is to.
It's to stabilize shoulder joint and medially rotate the humerus.
Which of these muscles depress the scapula?
The lower part of the trapezius.
The rotator cuff muscle includes the.
The subscapularis, the teres minor, and the infraspinatus.
Which of these muscles retract or adduct the scapula?
The middle part of the trapezius.
The action of the serratus anterior is to raise the sternum in deep inhalation. True or false?
False.
It draws the scapula anterolaterally. Which of these muscles compress the abdomen?
The internal oblique.
The action of the serratus anterior is to.
Protract and rotate the scapula.
Which of these muscles laterally rotate the humerus?
The infraspinatus.
Now let's go to origins and insertions of the muscles of the torso. Origin of the biceps brachii is the.
The supraglenoid tubercle and the coracoid process of the scapula.
The base of the mandible, the skin of the cheek and lower lip, the angle of mouth, and the orbicularis oris are the insertions of.
The platysma.
The origin of the sternocleidomastoid is the.
The manubrium and medial portion of the clavicle.
The insertion of the biceps brachii is the.
The radial tuberosity and deep fascia of the forearm.
The origin of which muscle is described as follows: the lateral border and the upper surface of the clavicle, the acromion, and the spine of the scapula.
It's the deltoid.
The origin of the rectus abdominis is.
The pubic crest and the pubic symphysis.
Insertion of the rectus abdominis is.
The costal cartilage of ribs 5 to 7, xiphoid process of sternum.
The insertion of which muscle is described as follows: the deltoid tuberosity of the humerus.
The deltoid.
Origin of the external oblique is.
The ribs 5 to 12.
External occipital protuberance, the nuchal ligament, the medial superior nuchal line, and the spinous processes of vertebrae C7 to T12 are the origins of.
The trapezius.
The posterior border of the lateral third of the clavicle, acromion process, and the spinal scapula are the insertions of.
The trapezius.
The insertion of the pectoralis major is the.
Lateral lip of the bicipital groove of the humerus.
Subcutaneous tissue of the infraclavicular and supraclavicular regions are the origins of the
Platysma.
The insertion of the external oblique is
The iliac crest, pubic tubercle, and the linea alba.
anterior surfaces of the clavicle and sternum, the superior six costal cartilages, and the aponeurosis of the external oblique muscle are the origins of which muscle?
The pectoralis major.
Aponeurosis of the posterior and anterior rectus sheath and the conjoint tendon to the pubic crest and pectineal line form the insertion of which muscle?
The transversus abdominis.
The insertion of the scalenes is
The first and second rib.
origin of the supraspinatus is the
supraspinous fossa and the scapula.
insertion of the internal oblique is
The linea alba, the pubis, and the ribs 10 to 12.
which muscle has the following origin? Spinous processes of vertebrae T7 to L5, thoracolumbar fascia, iliac crest, inferior 3 or 4 ribs, and inferior angle of scapula.
That is the latissimus dorsi.
Insertion of the teres major is
The medial lip of the intertubercular sulcus of the humerus.
costal margin, lumbar fascia, anterior 2/3 of the iliac crest, and the lateral half of the inguinal ligament form the origin of which muscle?
The transversus abdominis.
Insertion of the levator scapulae is the
superior part of the medial border of the scapula.
origin of the rhomboids, major and minor, is the
major spinous process of vertebrae T2 to T5.
what is the insertion of the latissimus dorsi?
That is the intertubercular groove of the humerus.
The origin of the levator scapulae is
The C1 to C4.
posterior tubercles of the transverse processes of. Yeah. What is the insertion of the rhomboids, major and minor?
That is the border of scapula.
What is the origin of the scalenes?
That is the cervical vertebrae C2 to C7.
What is the insertion of the supraspinatus?
That's the greater tubercle of the humerus.
The origin of the teres major is
The posterior aspect of the inferior angle of the scapula.
origin of the serratus anterior.
That's the upper 8 ribs.
Middle facet of the greater tuberosity of the humerus and the capsule of the shoulder joint form the insertion of which muscle?
That's the infraspinatus.
What is the origin of the quadratus lumborum?
The inferior border of the 12th rib.
The insertion of the serratus posterior inferior is the
posterior aspect of ribs 9 to 12.
origin of the serratus posterior superior is the
spinous processes and the supraspinous ligaments of C7 to T2.
What is the insertion of the longissimus?
The transverse processes several levels above the origin.
What is the origin of the spinalis?
It's the sacral and lumbar spinous processes and supraspinous ligaments.
Medial 3/4 of the infraspinous fossa of the scapula and the fibrous intermuscular septa form the origin of which muscle?
The infraspinatus.
What is the insertion of the serratus anterior?
The inner medial border of the scapula.
What is the origin of the serratus posterior inferior?
The spinous process and the supraspinous ligaments of T11 to 12.
The insertion of the quadratus lumborum is the
That's the transverse processes of I1 to 4 and the posterior third of the iliac.
Yeah, L1 to 4. That's lumbar 1 to 4.
L1.
The origin
L1
of the
to 4.
longissimus is
The transverse processes of the inferior vertebrae.
what is the insertion of the iliocostalis?
It is the ribs and the cervical transverse processes.
The insertion of the spinalis is
It's the spinous processes 6 levels above.
the origin of the iliocostalis is
It is the iliac crest, sacrum, and the lumbar vertebrae.
thank you so much, Mama Athena.
Hidden dog.
Wow, you did so well.
Thank you, dog.